Well, hello and welcome to Ask the Doctor. We're here in Meadville, Pennsylvania at Painkiller Hands with Dr. Corey Altabet. And on today's episode, we're going to be discussing the problem of TMJ. One of our viewers wrote in, and basically what has happened is they've been to their dentist, they've been diagnosed with TMJ, they've been wearing those night splints, which they're not that crazy about, but they've been wearing them.
Yeah.
And they've had, some relief, but they want to know, is there anything additional or anything that chiropractic care can do to help with the common TMJ problem?
Well, absolutely. And the reason we're so effective at treating that kind of problem is because most TMJ is just related to the muscles around the jaw. And chiropractors are famous, for relaxing muscles and improving the mechanics of any joint, for that matter. And to really understand this, we need to discuss a little bit about how the TMJ works. And for the most part, picture it, it's a hinge joint, like a ball and socket. It's right around here, right in front of the ear, and it opens up. And it's just like this. Okay. Now, normally, when a jaw opens, for the first 15 degrees, it stays in the socket. And then like a snake, after 15 degrees, it comes out of joint. And that's the normal motion for when you open your mouth wide. So at 15 degrees in the joint, the rest pops out of the joint. Now what can happen is, when the muscles are really tight, from stress and different things, and it becomes imbalanced, certain muscles get tight, certain ones stay loose. What ends up happening is that for that first 15 degrees, it doesn't pivot in the joint. It pops out. And what happens is, as it pops out, it rubs up against the top. And it constantly is popping. And that's why a lot of people hear that popping sound with their TMJ. So what my job is to do is to find those muscles that are tight and apply pressure using pressure points with a gloved hand. And instantly that adds blood flow to those muscles. They relax. And within seconds, the mouth is opening smooth and wider, much wider. And so they can take a bite of an apple again. Some of these people, they can't even open their mouth to bite a hot dog. And within like 1 or 2 treatments, the relief is almost instantaneous.
Now, so when you're looking at the TMJ problem, and one of the other questions that came in is their dentist is actually going past the night splints. They've been recommended surgery.
Right.
Okay? What can you tell us about, is it, if you've been to that point where you've been diagnosed and they're saying you need surgery, is it too late to try chiropractic care? Or is that something that you should definitely try before any type of surgical procedure?
Well, yeah. Well, first off, that surgery, it's brutal. It's not an easy surgery, and it sometimes successful, sometimes not. But without a doubt, chiropractic care is non-invasive, it's very safe. Probably a good idea to try something like that first before you go out and try surgery. That's definitely the way to go if you want to try and prevent any of the like a surgery gone wrong, if you will.
Right.
Sometimes they're successful and sometimes not, but your best bet is to just try and do something non-invasive first, like chiropractic care.
So that person that's watching this video right now, and maybe when they go to have an apple or a sub or something, and they're noticing some clicking, or maybe they haven't even been diagnosed yet.
Right.
Okay? But they're noticing that popping you're talking about.
Right.
They should definitely give the office a call.
Absolutely.
Come in, get an evaluation, because it's like anything else. If that just keeps doing that, it's always better to kind of nip that problem in the bud early versus than just deal with it.
Yeah, it does. It just gets worse. It's
right.
like a seed that just grows.
Mm-hmm. So if you're watching this video and you've got some some jaw problems, maybe you've been diagnosed, maybe you haven't, but you're noticing that clicking or popping, we encourage you to just pick up the phone, give the office a call. Come on in, let Dr. Altabet take a look at you. Let him explain to you firsthand what he can do and how chiropractic care can impact that problem. And as we talked about with surgery, it's always better to try every possible approach prior to any surgical procedure. So if you're at that point, it's not too late. Pick up the phone, give Dr. Altabet a call, come on in, let him show you how he can, possibly even put off that surgical procedure. So thank you very much for watching this show. We hope you found it to be educational and informative in regards to your problem with TMJ. If you should have any other type of question about anything at all that's bothering you health-wise, we encourage you to visit the website at painkillerhands.com. Click on the Ask the Doctor area and just type in your question. Let us feature one of your questions on one of our upcoming videos and shed some light on the problem that you've been having. So thank you very much for watching. We appreciate your time today, Dr. Altabet, and we'll see everybody on the next episode.